Okay, so today we'll continue our lecture. We are on the endocrine system. The last time we did the anatomy, we reviewed the anatomy and physiology. And then we talked about hypothyroidism. And then we did thyroid cancer. Thyroid cancer. Okay, so today we are talking about hyperthyroidism. Hyperthyroidism. Right. Okay, so that is what we are talking about today. Hyperthyroidism. Right, so, or sometimes you hear of exophthalmic goiter. Exophthalmic goiter, right? It's the same as the hyperthyroidism, but the exophthalmic goiter is the enlargement of the thyroid gland, whilst the exophthalmos is the protruding eye that the patient with this condition exhibits. So let's look at what hyperthyroidism is. Hyperthyroidism is a thyroid disorder characterized by an abnormally increased level of TSH as a result of increased activity of the thyroid gland, right? So when we are talking about the anatomy and physiology, we talked about the thyroid stimulating hormones. The thyroid stimulating hormones, which are the T3 and then the T4 hormones. The T3 and then the T4 hormones, right? So hyperthyroidism occurs when we have an abnormally or increased levels of the T3 and T4 hormones, right? So hyperthyroidism is a condition where there is an increased T3 and T4 hormones. It mostly results from any factor that will cause increased activity of the thyroid gland. So anything that will increase the activity of the thyroid gland can lead to increased production of the T3 and then T4 hormones. It is mostly common among women than men. It is common among women than men, right? Okay. With hyperthyroidism. Okay, so what is the difference between hyperthyroidism and thyrotoxicosis? Thyrotoxicosis. Right. Sometimes we see hyperthyroidism, sometimes we see thyrotoxicosis, and then they are similar but a bit different. Thyrotoxicosis is a clinical manifestation of a group of disorders characterized by high or increased levels of T3 and T4 hormones. So the manifestation that is exhibited by patients with hyperthyroidism is what we term as, so they are the clinical manifestations. That is what we term as the thyrotoxicosis. Thyrotoxicosis. Okay. What are some of the causes of hyperthyroidism? Why will we have increased T3 and then T4 hormones? One, the first cause is grave disease. Grave disease. Right? Grave disease is also a type of hyperthyroidism where there is the increased T3 and T4 hormones is as a result of autoimmune disorder. Right? So it's the body attacking the thyroid gland, right, leading to increased T3 and T4 hormones production, right? And then conditions like benign growth of the thyroid gland. So we can have multinodular goiter. Multinodular goiter, right, where there is a benign growth of the thyroid gland. And then adenoma of the thyroid gland is also a benign growth, right? And then sometimes there are congenital hyperthyroidism, and then sometimes you can have cancer of the thyroid gland itself, right? It can also lead to overproduction or increased production of the T3 and then T4 hormones. So most of the time, before you have increased T3 and T4 hormones, so normally we know that the hypothalamus controls the release of the hormones, right? The hypothalamus controls the release of the hormones. So anything that will affect the hypothalamus or the pituitary gland that produces the T3 and T4 hormones can, or the thyroid gland itself, can affect the production of the T3 and then T4 hormones, right? So anything that affects the hypothalamus, the pituitary gland, the thyroid gland itself, right? Because it starts from the brain, the hypothalamus controls it, right? So anything that affects any of these organs can lead to increased production of T3 and then T4 hormones, leading to hyperthyroidism, right? So conditions like the one we've mentioned, grave disease, toxic multinodular goiter, adenomas, conditions of the pituitary gland, conditions of the hypothalamus, etc. All these can lead to hyperthyroidism. Let's look at the signs and symptoms that someone with hyperthyroidism will exhibit, right? Most of the time, the thyroid gland controls the metabolic activities of the body. So if you have hyperthyroidism, all the activities of the body increases, right? So you are going to have most of the activities of the body being increased. So the person is going to have increased appetite, right? So there will be increased appetite. The vital signs most of the time increase. So there will be increased BP. There will be increased pulse, right? So there will be hypertension. There will be tachycardia. There will be increased respiration, right? So there is increased respiration, tachypnea. There is increased temperature, right? There is increased temperature, hyperthermia, increased temperature. Okay, so all the body activities increases. So there's systolic hypertension, tachycardia, elevated temperature. The patient becomes restless, agitated, and then confused, right? And then sometimes there is visual changes like blurred vision or double vision. The person feels fatigued because most of the time there is increased energy, so they indulge in excessive activities, right? So they usually feel tired all over. There's an apprehension, there is insomnia. It's not like they can't sleep, but they don't even have time to sleep. They want to be doing activities all the time. There's diaphoresis, right? Increased sweating, right? And then there can be anxiety, hyperactivity. There is unexplained weight loss. Why? They have increased appetite, but they lose weight because most of the time they are active, they are overworking, right? So they normally lose weight. They can also have periorbital edema, hand tremors, and then palpitations, right? So these are the signs and symptoms, and several others you can read and then get more and add to this. Causes, I've mentioned the causes of hyperthyroidism. Risk factors for hyperthyroidism include family history, right? So if any of your family member is having this condition, your chances of getting it is higher than someone whose none of the relative is having it, right? Gender, being a female increases your risk to this condition, right? Because of the high estrogen levels. And then severe stress, being exposed to excessive stress can also increase your risk. And then aging, above the age of 50 years, pregnancy can also increase your risk. Okay. We have anti-thyroid medications that are prescribed for people with this condition. Anti-thyroid medications, right? Anti-thyroid medications that are prescribed for patients with this condition. Example include metimazole. We also have SSKI, right? It's also another potassium iodide. It's also another drug that can be given, right? So you can read on the medications on your own. You can also give carbimazole. Is a type of they are classified under the thiomycin medications. So you have metimazole, carbimazole, and there's another drug known as the propylthiouracil, right? So all these are anti-thyroid medications that are given to help maintain what we call the euthyroid state. Euthyroid state, right? That is the normal T3, T4 levels, right? So even if a person is booked for thyroidectomy, we have to make sure we give medication to bring down the hormones, right, before the patient is sent to the theater. This anti-thyroid medication can cause side effects like thrombocytopenia. So it depresses the bone marrow, right, activity. So most of the time it leads to low production of platelets, low production of WBC. So it can lead to thrombocytopenia, leukopenia. It can lead to lymphadenopathy, right? So people taking this drug can have these manifestations. It can lead to drowsiness, headache, vertigo, paresthesia, feeling of pins and needles in the skin, or numbness, right? It can lead to abnormal hair loss. So it's not only chemotherapy, cancer drugs that lead to hair loss. This anti-thyroid medication can also lead to hair loss, right? It can lead to nausea and vomiting and mouth ulcer, right? So you can see that the signs and symptoms is similar to that of chemotherapy, the drugs that is given to treat cancer. So with the conditions that we've talked about, hypothyroidism, thyroid cancer, and then hyperthyroidism, most of the time the indication, if is that severe, the indication is surgery, which we term as thyroidectomy. Surgery, which we term as thyroidectomy, right? So with the thyroidectomy, the indications include cancer of the thyroid gland. Cancer, whether it's benign, so that we can have malignant tumor, we can have benign tumors like adenoma, multinodular goiter, etc. Then hyperthyroidism, and then again complications of hyperthyroidism known as thyroid storm, right? Thyroid storm. I will talk about thyroid storm soon. Complications of thyroidectomy includes hemorrhage, infection, like any other surgery. There can be hemorrhage, there can be infection, there can be hypovolemic shock. The laryngeal nerves around the thyroid gland sometimes